Welcome to this explainer. Look, pregnancy is an incredibly special time, right? And naturally, any sudden injury can cause just an immense amount of anxiety. If you or someone you love gets bitten by a dog while expecting, the panic can be absolutely overwhelming. But today, we're going to break down exactly what you need to know. We're going to transform that anxiety into actionable, life-saving medical knowledge. We'll look at the real risks, the proven treatments, and the dangerous myths you absolutely need to avoid. Will a dog bite harm my baby? Honestly, this is the very first terrifying question that pops into any expecting mother's head. So let's just answer it right away. The physical trauma of the bite itself, it rarely harms the baby directly. However, delaying treatment is extremely dangerous for both of you. The true danger doesn't usually lie in the impact of the bite, but in what the bite can leave behind. Early medical care is literally what protects both you and your baby. So here's our game plan for today. We'll cover understanding the real risk, the immediate first aid steps you need to take, assessing by categories, treatment and vaccine safety, and finally, debunking some common bite myths. Let's get right into it. Section 1. Understanding the real risk. Let's look at what actually makes this situation dangerous. Now, while physical injury and bacterial infections absolutely need medical attention, the most critical threat by far is rabies. The stakes here are incredibly high. Why? Well, because once symptoms actually develop, rabies is almost 100% fatal for the mother. And obviously, if the mother's life is compromised, the fetus is put at extreme risk too. It's a severe, unforgiving virus, no doubt about it. But hey, here is the incredibly good news. While those risks are severe, rabies is completely preventable if treatment is started immediately. You literally have the power to stop it before it even begins. It all comes down to acting swiftly and correctly, right after the bite happens. Which brings us to Section 2, immediate first aid steps. These are the crucial actions to take right away. In those critical first few minutes, you need to follow these steps in exact order. Step 1, wash the wound with soap and running water for 15 full minutes. Do not rush this part. I know 15 minutes feels like forever when you're panicked, but washing physically removes a huge amount of the virus right off the bat. Step 2, apply an antiseptic like povidone iodine, chlorhexidine, or even 70% alcohol if you have it handy. And step 3, get to a hospital immediately. Every single pregnant woman with a dog bite must be examined by a healthcare professional. No exceptions. Now, you might hear advice from well-meaning family or friends, but please listen to me on this. Traditional remedies like applying turmeric, chili powder, oil, or ash do absolutely nothing to kill the virus. In fact, using a dirty cloth or tying the wound tightly can actually make things so much worse by trapping the virus or causing secondary bacterial infections. Just completely avoid these. Moving on to Section 3, assessing bite categories. This is how doctors figure out your specific risk. When you get to the hospital, doctors use these exact World Health Organization categories to assess you. If it's Category I, meaning you were just touching or feeding a dog, or maybe it licked your intact skin, no vaccine is required. You're good. But listen to this. Moving to Category 2, even minor scratches or tiny abrasions without any bleeding, those still require a rabies vaccine. And for Category 3, which is bleeding, deep wounds, multiple bites, or bites on sensitive areas like your face or hands, you're going to need both the rabies vaccine and something called rabies immunoglobulin, or RIG for short. Okay, Section 4, treatment and vaccine safety. Let's talk about what happens next. This right here is where we need to address the biggest fear expecting mothers have. Please hear this. Modern cell culture rabies vaccines, like PCECV and PVRV, are completely safe in pregnancy. They will not harm your baby. Pregnancy is literally never a reason to avoid rabies vaccination. You should never ever delay this life-saving treatment just because you're expecting. Also, if you have a severe Category 3 bites, doctors are going to administer that rabies immunoglobulin, or RIG, we mentioned earlier. Basically, these are antibodies injected directly around the wound to provide immediate protection while your own body builds its immunity from the vaccine. And just like the vaccine, RIG is considered completely safe during pregnancy. It acts as a vital immediate shield for the both of you. To make sure that shield holds up, you've got to stick to the schedule. The standard post-exposure timeline kicks off on day 0. That's the day of your first dose. Then you'll need follow-up doses on day 3, day 7, and day 14. Now, depending on where you live, local guidelines might also add a day 28 dose. It is absolutely vital that you complete this full course to ensure total protection. Really, Don't just skip doses because the wound looks like it's healing, all right? Beyond just rabies, your doctor might set you up with some additional medical protections. Because dog bites can carry tetanus spores, they'll check your vaccination status and might give you a tetanus toxoid or Tdap shot. For deep or high-risk wounds, they may prescribe safe antibiotics like amoxicillin clavulanic acid to fight off nasty bacterial infections. Oh, and if the dog is someone's pet or is around, always observe it for 10 days. If the dog stays healthy, that's a great sign. But remember, never stop your vaccine schedule unless your doctor explicitly tells you to. Let's jump into Section 5, Debunking Common Bite Myths. Let's separate fact from fiction. Misinformation can literally be a fatal mistake, so let's clear a few things up right now. It is a proven medical fact that the rabies vaccine is safe for pregnant women. Here's another massive myth. My sweet pet dog can't transmit rabies. Totally false. Any infected mammal can transmit it. Also, just because there's no blood doesn't mean you're safe. Even minor scratches require the vaccine. And finally, traditional remedies absolutely do not cure dog bites or prevent rabies. Only proper modern medicine does. Of course, prevention is always the best medicine, right? These really simple habits can keep your whole family safe. Just avoid unknown or aggressive dogs. Don't disturb dogs when they're eating or if they're with their puppies. Make sure your own pet dogs are vaccinated regularly. Teach your kids how to safely behave around animals. And most importantly, always seek medical care immediately after any suspicious bite. So, the ultimate takeaway of this explainer is simple. Prompt treatment saves lives. You honestly do not need to panic if you're bitten, as long as you immediately take control of the situation. Wash that wound for 15 minutes with soap and water and get prompt, proper medical care. That early intervention is exactly what protects both mother and baby. So, as we wrap things up today, I want to leave you with this to reflect on. Knowing the hard medical facts, will you let old myths delay treatment, or will you take immediate action to protect 2 lives? Stay safe, stay informed, and always, always prioritize early medical care. Thanks for hanging out with me for this explainer.